Imagine a fire alarm that never stops ringing, even when there's no smoke, no flame, no threat. For millions with chronic pain, this is their daily reality. Clean scans, normal blood work, yet pain that defies explanation. Pain isn't just a simple reflex, it's a complex experience constructed by the brain, filtered through memory, context, and emotion. The International Association for the Study of Pain defines it as an unpleasant sensory and emotional experience. That word, emotional, is critical. When trauma rewires the nervous system, it can lock the body into survival mode. The amygdala becomes hypervigilant, the stress response stays stuck in the on position, and normal sensations, a touch, a stretch, a heartbeat, are misinterpreted as threats. This is central sensitization, a condition where neurons in the spinal cord and brain become hypersensitive, amplifying pain signals even without ongoing tissue damage. What starts as protection becomes a pathological loop, generating pain to compel action in a body that's already safe. In the 1990s, the Adverse Childhood Experiences study surveyed over 17,000 adults about childhood trauma, abuse, neglect, household dysfunction, and correlated it with adult health outcomes. The results were staggering. Individuals with 4 or more ACEs were twice as likely to have arthritis, 2 to 3 times more likely to develop fibromyalgia, and significantly more prone to chronic headaches, back pain, and pelvic pain. The relationship was dose-dependent. The more trauma, the greater the risk. This wasn't a small effect. It was a biological signature written into the body. A 2017 meta-analysis of 85 studies confirmed that childhood trauma increases the risk of chronic pain by 1.5 to 3-fold, an effect size comparable to major genetic risk factors for other diseases. How does a memory become a physical sensation that lasts for years? Neurobiological pathways reveal the answer. Functional MRI scans show that trauma survivors have heightened activity in the anterior cingulate cortex and insula, regions tied to the emotional dimension of pain, when exposed to mild stimuli. Meanwhile, the prefrontal cortex, which normally helps regulate emotions, shows reduced activity. This imbalance makes pain feel more intense and harder to dampen. Trauma also dysregulates the HPA axis, the body's stress response system, leading to abnormal cortisol patterns that sensitize pain pathways and promote inflammation. The result is a perfect storm: a nervous system primed to overreact, a stress system that can't self-regulate, and a body bathed in inflammatory signals. Dr. Bessel van der Kolk, author of The Body Keeps the Score, argues that trauma is a physical imprint, not just a psychological wound. In his clinical work, he found that trauma survivors often develop chronic pain in specific body regions corresponding to past abuse: pelvic pain in survivors of sexual assault, throat pain in those who were silenced, chest pain in those who felt suffocated by neglect. This isn't mystical. It's the body's way of storing memories that the mind has suppressed. The pain becomes a somatic narrative, a physical echo of an experience that was too overwhelming to process. For these individuals, the body truly keeps the score, even when conscious memory fades. Understanding the trauma pain link opens new doors for treatment. Approaches like trauma-informed cognitive behavioral therapy, eye movement desensitization and reprocessing, and somatic experiencing help patients reprocess traumatic memories and calm the overactive nervous system. Physical therapies that focus on gentle movement and body awareness can also retrain the brain to interpret sensations as safe. The goal isn't to deny the pain but to address its root cause. For many, this shift from "what's wrong with me" to "what happened to me" is profoundly healing. By treating the trauma, the chronic pain often diminishes, not because the body was lying, but because the alarm system finally learns to rest. If you found this exploration valuable, consider sharing it with someone who might need to hear it. The body remembers, but it can also heal.